Okay guys, so I just sign into my accounts. So if you can see, there is two arrows, like one is for the forward arrow and one is the backward arrow. So I started my process already, so that's why it's like in green circle. So this is called College Connect application, which fulfill all the application process for the registered nurse. So College Connect application, they gave this window. So I already started my process. So if I click on the next window, profile accuracy, so they will ask you about your demographic profile, your date of birth, your home address, your telephone, all this stuff. So when it's done, you can go to the next one, and it's the identity validation. So in identity validation, you can give your driver license, your PR card, or your passport, any government ID. And then you have to click your picture, like there is a front camera, so you can click your own face picture and upload both the identity together, like one is the driver license and one is your own photograph. So just make sure, because I think when you upload your identity, like your passport or your PR card, so sometime they click picture automatically and then submit that picture to the website, and if this picture is not clear, so they're gonna reject it. So I call many times to CRNA to redo my identity validation, because my passport picture was not really good and it uploaded by itself, even I did not upload on the website. So I told them and I called them to reset it for me, and you just only reset 3 times. Fourth time they told me like you need to come to the center or the Karna office to check your or to approve your identity validation. So just make sure it's only 3 time attempts. So when you're done with identity validation, next is criminal record check. So criminal record check are conducted via third party partner, that is called Sterling back check. So as a part of the application process for all new applicants or who are living in Canada, so Sterling back check do the criminal check with no extra cost, because you already paid your fees when you apply your account, when you started your account. So Sterling Backcheck directly sent the results of your criminal record to the Karna, so you don't need to do anything for that. So next one is the protecting patients. So it's a essential education that you have to do online. So all the applicants must complete this online education course. This is a kind of sexual abuse and misconduct course which you need to do online, and at the end of the course you're gonna get some questions that you need to answer. So you can reattempt this exam, so that is the easy part of this one. So it just gonna take maybe 2 hours maybe to complete this online education, and at the end of the education you gonna take some questions you need to answer. So next one is jurisprudence exam. I'm sure all the RNs who done RN exam before, they have given they have taken jurisprudence exam as well. So yeah, this exam is the same, I would say, but it's really easy than that one. And in this exam as well, you can retake the exam, and at the end of the learning you have some question that you need to answer. So all together, first you need to take jurisprudence, and then they will give you the protecting patient from abuse, sexual abuse and misconduct. So these both will come together. First you have to take jurisprudence, and then you have to take protecting patients from sexual abuse. So both exams you can reattempt it, so don't worry about that. So next one is English language proficiency. Okay, so English language proficiency, I think we all like stuck on this process. Everybody I know, everyone is like afraid to take IELTS exam again, because I know we are international students and we have taken English proficiency test many times, and we are really, I would say, like very disappointed if we need to take, or if we need to approve again that our English is well. So if first is anytime, so there is one option that you can submit anytime, and that is successful completion of nursing education program of at least 2 years of full-time study in Canada, where the theory and clinical were provided in English. So the thing is, if you have studied in Canada 2 years full time, and your theory and clinical is in English, then you can submit this requirement anytime. Anytime means it's either you have studied 5 years back, 6 year back, but you have done your 2 year study, so you can submit that one. If I talk about in past 2 years, if in past 2 years you have taken Salban or IELTS exam, you can submit these two. So for Salban, the requirement is like listening 9, writing 7, reading 8, and speaking 8. And IELTS is like overall 7 bands: listening 7, writing 6.5, reading 6.5, and speaking 7. So if you have taken IELTS and Salban in past 2 years, you can submit these results to the website. So first I told you anytime. If you have taken 2 year course anytime, you can submit that one, but English and Salban only then if you can taken last 2 years. Okay, so next is within past 5 years. So, if you are a nurse practicing in any healthcare setting and you have at least 250 hours in that hospital or long term care, whatever, so you can submit your English proficiency. You just need to get a letter from your long term care or from your hospital that you are providing all the services in the hospital and your first language is English, and you have completed at least 250 hours, so you can submit that letter to the website. Next thing, if you have completed nursing education program for at least full-time study outside of Canada where the theory and clinical were provided in English. If in the past 5 years you have done your any program outside of Canada and your college gave you a letter that your education was in English, so you can submit that one. So you have three options: anytime, in last 2 years, and in last 5 years. So in last anytime is like if you have done any course in Canada, so you can submit that anytime. If you have done IELTS and Salban in last 2 years, you can submit that. And if you have in last 5 years you have done study outside of Canada and that is in English language, like clinicals and theories in English, so you can submit that one. So this is how you can fulfill your English language. So next is other jurisdiction verification. So other jurisdiction verification is the verification. If you suppose if you are RN in Ontario, so you have to go to your CNO account, and there is a option called verification for other jurisdiction. So you need to fill that form. You have to fill that form, and in form they will ask you like which jurisdiction you need verification, so you will put just Alberta. So they will automatically send their results to CRNA. So that is how this jurisdiction verification would be done. So I applied to CNO, and within 2 days, maybe 3 days, CNO sent their results to CRNA. So it was really fast process, and I think I spent almost $40 or $50 for this need, yeah, for this one. Next is fitness to practice. So there are some questions they're gonna ask you. It's not a big deal, it's like a really easy process. So fitness to practice, they will ask you about like some questions like you are fit, you are practicing, your character, your physical and mental health condition, or if you have any disorder, any impairment, any inability to provide nursing care. So these type of questions, that is easy. Next is good character. So that is also a type of question answers where they will ask you about your character, uh, like are you plead guilty or have been found guilty any criminal offense inside Canada, or any uh, I need your license denied, revoked, or cancelled, or suspended. So these type of questions. So you need to just say yes or no. Next is confirm permit effective date. So like in this they will ask you when you are thinking that you going to uh, start your practice. So you just fill the date whenever you are going to start your practice. So that is thing.